Introducing best-selling author and Emmy Award-winning chief medical correspondent for CNN, Dr. Sanjay Gupta.
Good evening, everybody, and happy birthday to Simon & Schuster. I want to tell you a quick story. One night a few years ago, I was in the operating room on call when one of my residents brought me an emergency CT scan of a man's head. Immediately, the problem was really clear to me. Just between the man's skull and his brain, there was this concave strip of blood, something known as a subdural hematoma. It was causing pressure on the man's right frontal lobe, and this is typically a surgical emergency. Now, just as I was getting ready to take the next steps, the resident told me the patient's age, 93. Suddenly, several things started to swirl in my head. What kind of life did this man have? What kind of life would he want? And where is that line between prolonging life or prolonging death? I thought a lot about my own parents. What would they be thinking at that age? With all this in mind, I went to go talk to his family to have a conversation. Now, a woman who looked to be only in her 60s walked over to me, introducing herself as his wife. I momentarily hesitated, and sensing my confusion, she said, "I'm actually older than he is. I robbed the cradle." She was 94 years old. She was in perfect health, took no medicines, was still driving, and had in fact driven her great-grandkids to school earlier that morning. Her husband, my patient, the 93-year-old, I was told was even healthier than her. He was still an avid runner, worked part-time as an accountant. They kept him around, his 65-year-old son told me, because he was such a whiz with numbers. In fact, his brain bleed had occurred because he had fallen from a roof because he'd climbed up there with a leaf blower to clear away the leaves. These nonagenarians, as they're called, were healthier than most of my patients at any age. So given all that, I took the man to the operating room to perform a brain operation known as a craniotomy. You drill several burr holes into the skull, use an electric saw device to connect those burr holes, and you remove a flap of bone. After that, I opened up the outer layer of his brain, known as the dura, and then I was looking at that large collection of blood. I carefully removed that blood collection, stopped any remaining small bleeders, and the critical part of the operation was completed. The man of the brain was decompressed. Now, all that was left to do was close the dura, replace the blown flap, and suture the skin. Before I did that, however, I decided to closely inspect his brain, and what I saw really surprised me. Given how sharp he had been, how cognitively intact, I expected to see this large brain pulsating robustly, looking healthy. And what I saw looked like a 93-year-old's brain. It was more shriveled, it was more sunken, had these deep wrinkles indicative of his age. Now, if this sounds disheartening, it should not. In fact, just the opposite. It's a reminder that it didn't matter what his brain looked like, it mattered how it performed. Of course his brain had aged. He was 93 years old. But the brain, maybe more so than any other organ in the body, can reliably grow stronger and grow sharper throughout life. I think it's the only organ that in many ways can defy aging. It's what inspired me to write the book, Keep Sharp. Now, as you might imagine, I was anxious to see how this gentleman would wake up from the operation. I went to go visit him in the ICU, and I found him lying in bed reading his smartphone. He told me he was following the recent elections in West Africa, as one does after emergency brain surgery. It was pretty clear that he was recovering well, and after examining him, I decided to ask him, how did the whole event really affect him? How did it make him think about his mortality overall? He smiled and he looked at me and he said, I think the biggest lesson in all this is no more trying to blow the leaves off the roof. That guy taught me a lot. You see, increasingly, we think of someone like him as the exception to the rule. But I think our thinking is starting to shift. It is possible that 93-year-old man is becoming the rule. Happy birthday, Simon & Schuster. Thanks for having me. What an honor.